Are there travel options for anesthesia jobs? Absolutely. So it's called locums tenens jobs. I was a travel nurse from 2020 to 2023, and I will probably work a W-2 job as a CRNA for a few years before I hop into locums work, but I will absolutely be doing travel anesthesia. For a lot of people, they like to think of it similar to travel nursing in terms of like how the contracts are set up, but essentially you're filling a staffing need for an anesthesia group or for a facility for a pre-agreed upon determined set amount of time. Often you are a 1099 employee instead of a W-2 employee. You can kind of negotiate the way that you want to be paid and which tax structure you want to go with. There are a lot of parallels. So just like with travel nursing versus staff nursing, if you are a W-2 employee, anesthesia provider at a facility or at an anesthesia group, you know your coworkers, you know the politics inside and out of the anesthesia group or of the facility. You have a little bit of preference for like professional development and for the assignments that you want versus if you're coming in as a locums provider. They will take your skill set into account is my understanding. However, you're there to fill a staffing need. So you're not always going to get the same like professional development opportunities. You're also not going to pick on every single case that you might want to take if you're doing locums anesthesia versus W-2. And my understanding currently as a student is that similar to nursing, it's in your best interest to take your first job out of school somewhere that is a really broad case mix where you're going to continue to learn and be nurtured by the anesthesia team, but also challenged. So if you hop straight into kind of bread and butter, it can be a little difficult to go back later in your career and like take those hard, advanced, difficult cases, which is why personally, I'm probably going to work at a W-2 job for like a year or two out of school before I look at locums jobs. Other people graduate school feeling ready to hop straight into locums, which I'm not here to really talk about. But I know for me, I'm probably going to work in a like well-supported anesthesia care team environment. Also maybe independent practice. A few of my rotations are independent practice with high acuity patients and a really good case mix. So I'm interested to see how I like that. But yeah, there's definitely travel options for anesthesia people. Gaswork.com is a good place to look, and so is CRNA Locums Instagram account. You want to get kind of like a range for what the market looks like.